The healthcare industry globally is recovering from the pandemic, which strained healthcare systems. In Uganda, average healthcare costs vary based on service type, facility location, and individual circumstances. Statistics show a 22.9% increase in medical care costs in 2021, followed by a drop of 9.9% in 2022. IP services increased by 25.1% in 2021 and dropped by 0.4% in 2022, while pharmacies saw an increase of 27.4% in 2021 but dropped by 11.4% in 2022. Laboratory costs rose by 26% in 2021 and decreased by 16% in 2022. According to Uganda Insurance Association, manual systems account for 30% of the current losses, with only 1% medical insurance penetration rate. Bridging the gap between the healthcare sector and stakeholders is crucially needed.
I think I mentioned that today we are only covering about 1% of the population. Now, I will tell you that the 99% that we are not covering is probably out of formal employment. But these people, the 99%, still require our services. So how technology and automation is going to help is in the aspect of access. It means that if we can adopt technology, we can reach many more people. Now, of course, the majority of my members are within cities or towns. So you will find that anyone outside the major cities, the major trading cities and towns, will not be able to access medical insurance. Now, with these kind of applications, it means that even onboarding clients and
innovations, especially in the digital platform, we are going to all have to benefit. For example, if I go down to the clients who come to us, we know on average they spend about six hours in our health unit. And in the 6 hours, what are we doing? I can assure you behind there, for about 4 hours, we are just collecting data. We are collecting data, especially in a non-digital setting. For example, when I used to work with the government, there will be a lot of recording done, and this takes time. Sometimes you have to go and pick previous records to put in the file and all this. So you are wasting about 4 hours of the client's time. And this time, if with the digital applications can be saved, we can all benefit. The client will leave the health unit earlier and can be able to go and do other things. But for me, also as the health worker, I can see more clients in the 6 hours. So everybody benefits. And
to harness this potential, the healthcare industry's future depends on technological advancements for accessible, affordable, and high-quality care. Indigenous, convenient, patient-based, and smart technologies are vital for enhancing the speed and efficiency of healthcare service delivery across all levels. This approach aims to expedite the access to healthcare services, as explained by the country director of Smart International Limited.
Now, how we've been able to handle the traffic is, you see, these systems must work in tandem. So you have a provider having a system, but you also have Smart enabling the member to reach the service provider. So we're saying that, indeed, in my presentation, I mentioned that not all service providers have systems. So the essence of automation of their back-end systems is very important, like having a hospital management system. Because the biggest challenge is retrieval of medical records. You have come, you are called Mary. How long does it take them to retrieve your records since you last visited and then give it to the doctor? Whereas with automation, all they have to do is go and identify you with your unique member number and your records come up. So what we have done as Smart, to shorten that process, we also integrate our systems with the existing service provider system. Once we do that, then the retrieval of medical records becomes a lot easier because the information is passed between the two systems, they're able to retrieve the record and the process starts.
The government has taken steps towards enhancing healthcare delivery and cost management in Uganda, whereby there is an existing exemption on the supply of services to conduct a feasibility study, design and construction, the supply of locally produced materials for the construction of premises and other infrastructure machinery, as well as equipment for furnishings and fittings to a hospital facility developer. Partnerships between healthcare administrators and service providers supported by data and insights, are tipped to support the success of the industry.